Welcome to Nursing School Explained and this video on donning sterile gloves. Sterile gloves are needed and mostly come in the packages of when a sterile procedure is needed. This might be a catheterization, a wound change, a dressing change, as well as maybe a central line dressing change. Those are the most common ones that we'll encounter. Now in these procedures, typically they'll come in kits with all the supplies that you need, and then also a package of sterile gloves that is provided in the package with all the other, let's say, dressing supplies. So it is very important to know how to apply the sterile gloves, not only within the sterile kit, but also separately, because you might also need to don sterile gloves outside the packet. And from my experience, I see students struggle with the application of the sterile gloves. And then when it comes to, let's say, a skills evaluation, they get very flustered and frustrated when they can't put on the gloves appropriately. And then the skill evaluation is more difficult because of just that one skill that is just part of that whole skill evaluation from, let's say, a catheterization. So first of all, make sure that you know the correct size of sterile gloves that you wear. They come in half sizes, so let's say a 6, 6.5, 7, 7.5, and so on. The higher the number, of course, the bigger the gloves will be. If the sterile gloves don't fit you appropriately, it's going to be very difficult to maintain sterility throughout the procedure. Also, you want to make sure that you perform hand hygiene before you slip those sterile gloves on, as well as that your hands are dry. Otherwise, it's going to be very difficult to slide the gloves on, and it could be a very frustrating experience for you. These gloves here in particular are a size 7. They fit me pretty well. And then always look on the front and see what material they're made of. Most gloves now come latex free, and some are still powdered, and some people are allergic to the powder that the gloves come with. So make sure that you read the label of the package to see what they're made of and if there's any powder. And of course, if you have any trouble with those materials, then make sure that you use another one. So first of all, let's unwrap the package, and we can take the paper wrapper out. As you can see right away, it tells you cuff N, so this is the part of the wrapper that you should put towards you, which is the cuff that'll be right at your wrist. So you will open this package up and try not to touch anything within where the gloves are. Again, it's very nice because it tells you left and right, so I'm going to set this up right in front of me with my left and right hands. You can also see that the package shows you what side the thumb is in, so the gloves will actually be in this, located like this inside this wrapper. Now, because they are folded in a certain way, it might be a little bit difficult once you open this up. This paper flap tends to want to come back, so I recommend just kind of folding it the other way and folding it down. That way it has a tendency to stay up better. Then the center here has this nice fold here with the paper where we can just reach to it from the outside and open up the gloves. Now, one of the most important things to remember here is that whatever part of the glove will be in contact with your skin is the one that you don't really have to worry about. What we have to worry about remaining sterile is whatever is going to be on the outside towards the patient. And you want to start with donning your non-sterile hand first. So in this case, I am right-handed, so I'm going to grab this cuff here on the inside, and this part will be on the inside of my hand, so I can touch it, but I cannot touch the cuff on the other side or the fingers. So I will slide my non-dominant hand in there, knowing that the thumb is lined up this way like the wrapper told me. And then I can pick the glove up off the wrapper And be careful that when you're trying to wiggle your fingers in there, that the loose ends of the fingers don't touch anywhere, either within that 1 inch margin of your sterile field or outside the sterile field. So what I like to say is bring it up to about chest level. That way you're not in danger of doing that. So now I've slid on my non-dominant hand. Eventually I'm going to want to straighten out this cuff, but for right now I'm just going to leave it as is, because I cannot touch the inside of the cuff right there because my right hand is currently not sterile. Now this hand is sterile and these fingers are sterile, so I can touch this glove wherever I like, but I have to be careful that with my sterile gloved hand I don't touch my non-sterile hand. So I will grab this right glove here at the cuff and actually slide my fingers into it, so that then once I slide the glove on, I won't be in contact with my sterile glove and my naked, my ungloved hand. I will slide my hand in here, and again, make sure you have the correct size, otherwise it's going to get difficult. And then also make sure that you know where the thumb is, and if it happens to be a little discombobulated, that's okay. Just stay on the outside here and make sure you don't touch the inside, and just wiggle your fingers in there. It might not be very pretty, but this is a good size for me. So my hands are now in here. You can see I have the cuffed end here, sterile to sterile. Now what I can do is I can maybe wiggle the fingers down so that they fit better. And now I want to address the cuff of my left hand. So with my now both sterile hands, with this right hand, I can slide inside the cuff here because this is all sterile, and slide the cuff up my wrist or forearm. Now both hands are sterile. If I was to move on to a procedure and I need to get rid of this wrapper, I can touch it here because the inside is still sterile, so I can get a hold of it like this, being careful that this doesn't touch me, and then just throw it away. So these are my sterile gloves now. Make sure that you don't drop your hands below your waist level, because below waist level is also considered non-sterile. And as soon as you do that, then you have contaminated your sterile gloves and you would need to do the skill again. Thank you for watching this video on how to don sterile gloves. Please also make sure you watch the other videos in my skills playlist about catheterization for both male as well as female patients, wound care, dressing changes, and any other skills that you might find helpful. Please give me a thumbs up if you've enjoyed this video. Follow me also on Instagram for quizzes and study tips, and I'll see you soon right here on Nursing School Explained. Thanks for watching.